What makes the most difference is the voluntary component in orthopaedic surgery. So in many types of surgery, if not most, the voluntary component is minimal. The patient has minimal influence on the outcome. The surgery makes a big difference, whereas in orthopaedic surgery, patient compliance, effort and motivation are major components in successful outcomes. And that's been a major frustration in orthopaedic surgery for the decades that I've worked in it. We haven't had a way of measuring the voluntary component that's necessarily been very accurate, and yet that often makes a huge difference to a patient's ability to deal with injuries, to prepare for surgery, or to get better after surgery. So in those three key areas, this area of compliance, motivation, effort is a major factor. Obviously there's been a lot of interest in the area for a long time. What has changed is our ability to measure, and our ability to measure remotely in particular, especially in my practice. So traditionally, just for a bit of background, we've used what we call patient-reported outcome measurements, or PROMs, to measure how successful we are as surgeons in orthopaedic surgery. But by definition, a patient-reported outcome measurement is subjective and therefore has significant limitations in terms of reporting on those three things I mentioned, which are compliance, motivation and effort. So the other thing I should mention is that in this market there's been massive investment in what we would call wearables, so Fitbits, Apple Watches, things that ostensibly report performance or claim to report performance at a highly accurate level. And I need to mention that because those things are useful, but at the same time the information that's measured is often broad spectrum information. So are you moving as opposed to not moving? Are you breathing as opposed to not breathing? The accuracy of that information and the precision of it I would call into question. So there are very sophisticated, complex algorithms that are used to fill in the gaps which are significant in that data collection. What we have done by contrast is we've majored on precision and accuracy. So we've found what we believe is the most accurate device available in professional sport, and we've applied it to orthopaedic surgery. So we've taken something which is actually an Australian design called the infracrank power meter, which is used in professional and elite cycling, and we've applied that to monitor, measure, accumulate data for patients. And we can do all that remotely just using a regular pedaling device. And we believe that that's a major advance forwards in how we can monitor and measure these things remotely. We know already that people can manage their own conditions such as knee arthritis. If you take the typical degenerative condition where the joint slowly wears out over time, it's very clear now that patients can manage that process if they understand the dynamics over a period of time, sometimes for years, sometimes for good, and they can avoid surgery, avoid hospital and avoid complications. So what we have done is majored on the accuracy and precision of monitoring that whole process and enabling the patient to manage their condition and making that fun and entertaining, sure, but at the same time not compromising the accuracy and precision of the data collected, so that you know how your body is responding to a variety of conditions. And that enables really the patient to take control of their condition and to manage it remotely. Well, we're running numerous studies at the moment. The most obvious place we've started is actually post-operative studies for knee replacement patients, and what we call accelerated rehabilitation pathways for knee replacement patients. How can we prepare you best for surgery? How can we shorten your hospital stay? How can we monitor you at home and make sure that you're doing everything you need to do, but remotely in your own home at a place that's comfortable for you? That's really revolutionary. We can do it far more accurately than anything else on the market. We're talking about something that's really at the cutting edge of research that I think will redefine the way we take care of our patients in the future. If you want to be involved, it's very exciting, and please call my rooms or contact St John at Murdoch for more details.